Hello, everybody. What's up? Welcome back to another episode of A Needle in a Haystack, a behind-the-scenes account of a mucosal melanoma survivor. I'm Chris White, mucosal melanoma survivor, thriver, advocate, inspirational speaker, and self-published author of Killing Cancer with Tills. All right, real quick before we get started, little disclosure. Y'all know the drill. I am not a medical expert. I am only an expert on my story and my experience. If you need any medical attention or advice, please seek out your care team. All right, we are back now on episode 11 and picking up from episode 10. I did all my scans. I just went over all the results from the last episode. This right here is the meeting from that appointment. Check it out. Peace.
Okay, some of them in the lungs, they grow from 1.2 to some 2 centimeters.
Can you pull it up on the deal so we can see it this time too? Or?
Sure.
Okay.
But overall, we'll show you right now. Overall, everything has grown. So the immunotherapy is not working at the moment. The next step right now, what we need to do, and very quickly, is to move you temporarily for chemotherapy. Chemotherapy, as we talked about, it is, if it works, it doesn't work for a long term. So, but the first thing to see that we need to reduce some of the tumor burden, which I will show you in a second.
Yeah.
And that will be for a short term before we do something different after that, okay? I will be talking, but at one point, well, let's do it step by step. Let me show you what we're talking about. How are you feeling overall?
Overall, I feel good.
Any nausea, vomiting?
No, not at all.
I looked at your MRI. It's not fully red, but I didn't see anything in the brain. So
Okay.
that's good news in that aspect.
Yeah.
Any itching?
A little bit.
Where?
Just like my legs and
Okay.
arms. You know, I think that's from the pain pills though.
I don't wanna. I'm gonna try to keep the upheaval going with the chemotherapy. I don't want to drop it completely.
Okay, I might still need to finish the other 2 treatments though, of the original
We
plan?
don't have time for that.
Okay.
And then it's just, I want to switch to chemotherapy at the moment.
Okay.
Alright. So you're looking at your lungs from the top. Imagine you're putting your head inside your neck right now.
Okay.
Looking at the
Bird's
lung
eye
from
view.
the top.
Okay. And is the one on the left what it currently looks like?
This is the old one.
Okay.
This is the new one.
Okay.
Yeah? So look at the neck, you see those 2 small ones. They look a little bit bigger here. Okay?
Okay.
Remember, we're comparing not exactly things because that was a PET scan, so
Yeah.
the setting is not exactly the same. But, for example, this one is not being captured here.
Okay.
This one. And there's a new one. This
Yeah,
one.
last time it was showing the pictures since it was the pet, it would be the full body silhouette.
But this is in order to
Yeah.
compare size to size, and if you, so this, look at it, look how it's measuring here about, again, that's not 100% accurate because it's a bit, it's about 1.2 centimeters. Here it looks. About 2.3, 2.4 centimeters. So, and in that situation, most of these lesions have grown a little bit. And you can get the CDs, and we'll give you the CDs to show your doctors. So,
Mhm.
one of these lesions, one of our lesions that has grown. See, all these things are.
Mhm.
This is the one that concerns me. Sorry. This is the liver lesion, the dark one.
Yeah.
And that has grown significantly. And this is another mass behind the right kidney. See it?
Mhm.
That has grown as well. So, and there's other in the peritoneals like this one. You see it?
Uh-huh.
That's it. The disease. Now, if we didn't have the liver and we didn't have that much of numbers in the lung, I would have gone with another 2 doses with the ipi/nivo because I want to give them more time, and that would be the right thing to do. I will be worried that in another 2 cycles, if you continue not to respond to immunotherapy, this will be causing much more symptoms and will be much more pain. My first approach is that we will drop the Yervoy. Please have a seat. We will drop the Yervoy and we will add chemotherapy.
So keep the Opdivo.
Keep the Opdivo going.
Okay.
And it's called CVD. Now it's not the Opdivo.
It's
the Keytruda.
We went over. Is it the same treatment you wanted me to do prior to before?
CVD plus the Keytruda. Okay.
Yeah.
Now, and the insurance don't always approve it. We're gonna make a big fight for that, but it doesn't matter. We have to start the CVD. Now we want the CVD. But CVD is 3 chemotherapies, and I'll give you them: cisplatin, vinblastine, dicarbazine. And we will let your doctor know, and we will let her take the.
So, but same thing every 3 weeks.
It's every 3 weeks.
So next week when I go in for my regular deal, instead of.
Yeah, but that will be 4 days of treatment. It's not going 1 day because
it's not. Okay.
The cisplatin, which is the most powerful gun of the chemotherapy, it will be giving over 3 or 4 days.
How many times do I need to go in?
We need to go in 2 cycles before we repeat the scans and see, because chemotherapy will work immediately.
Yeah.
Okay, but so if it doesn't work after 2 cycles, it's not working.
Yeah.
Okay. Now, and sometimes the background of the immunotherapy will be helpful for the chemotherapy. Sometimes prior immunotherapy will sensitize the tumor to be more susceptible to chemotherapy. And I did molecular analysis. I analyzed your tumor. You have those 2 genes defected. These are a lot of the genes in your cancers. The one that says are defected, the CDK4s. That's very.
And there a clinical trial or something?
That's commonly defected in breast cancer. There are clinical trials. I've seen the clinical trials, but there's a drug approved for that, not for melanoma, for breast cancer. I'm gonna try to get it approved for you and keep it combined with immunotherapy. Together, I will be seeking for clinical trials with the CDK4. Then together we will choose what's the next step. And that probably will happen imminently, because if you respond to chemotherapy, I still want to enroll, and at one point I maybe get more mileage in the chemotherapy. Instead of 2 cycles, give you additional 2 cycles and shrink the tumor minimally. I'm trying to use that. There's a lot of data using the drug inhibit that genes, the mutated genes, with immunotherapy, that it works. This could be possibly preventing immunotherapy from working. Possibly, not 100%. You know, this is all areas of investigations right now. It's not 100% no. So the next steps, so not to confuse, I'm just giving you a glimpse of the plans that we're already planning for Plan C. There's a Plan B right now, which is going to become Plan A right now, as chemotherapy, with or without immunotherapy. If we can squeeze immunotherapy, that's fine. If the insurance is not going to give us our time, we're not going to delay that, because we need to shrink the tumor risk. So here's what I'm suggesting. Next step will be chemotherapy, known as CVD, plus minus a drug called Keytruda, which is equivalent to Opdivo.
Okay.
And why I'm switching? Because that can be given every 3 weeks. So Opdivo, that, nothing else. It's not better, it's not worse. Just to be able to give it with the CVD.
Okay.
We'll do that for 2 cycles.
First one starting next week.
We're going to call your oncologist. This should be approved easily, so she should not have a problem with that.
Okay.
And then 2 cycles, repeat the scans. And based on the scans, we want to decide. If there is a response, I probably will give additional 2 cycles.
Okay.
It depends on how good the response is that.
Okay.
And at one point, we will see when we're going to incorporate that, either per clinical trial or per try to get it approved through the insurance,
Okay.
which I had done in the past, but we will see. Okay.
Okay.
The optimal way is to do it through clinical trial, and we will have a clinical trials.
Okay.
The side effects from this CBD.
Yeah, that was.
This is gonna be like that. These are chemotherapy. So
Yeah.
typical side effects of the chemotherapy.
I was all ready for that 6 weeks ago.
Yeah, so chemotherapy is, again, let me be
Yeah.
frank with you. I will be suboptimal doctor to treat you with this first. You know, I mean, I needed you to get the best treatment for melanoma. And the best
Right.
treatment for melanoma is the epineural.
Yeah.
Okay, that is without any doubt, and you may still gain benefit
Yeah.
from that. Chemotherapy does not prolong survival, so we're using it as a bridge. That's
Okay.
what I'm thinking about, what's after.
Okay.
You tell me, well, how do you know it's not going to work? Well, that's why I'm telling you, even if it works, I'm
Yeah.
getting because it does not have the marathon runner features, the long
Yeah.
term things for that. So, nausea, vomiting, you might have it. We'll give you a lot of anti-nausea. I rarely see vomiting. I almost
Yeah.
haven't seen any vomiting since I practiced. So, because we give you a lot of anti-nausea medications. You still feel queasy for
Right.
3 to 4 days. Most people feel them after they get the treatment.
Yeah.
So the treatment is 3 to 4 days, and 2 days later you'll feel that down, and then you'll recover from that. You will have some hair loss. It's not notoriously known to cause a lot of hair loss, but some people sensitive, so you might have that. Your immune system will go down. I don't like to stay around sick people anyway, so
Right.
that's it in that situation, but we will give you a booster for that scenarios. The cisplatin may cause non-toxicities as neuropathy. You may feel tingling sensations, sometimes you feel numbing, usually with multiple doses, not with 2 doses or 4
Yeah.
doses,
Okay.
but it can happen. Cisplatin known to cause kidney problem. For that we give you a lot of fluids. It is not very common, it's less than 10% that patient develop kidney problems. We give you a lot of fluids to prevent that, so we decrease the incidence. And again, it's usually associated with more doses, not with 2 doses or 4 doses, but it can happen. And lastly, it can cause, very rarely, but some hearing problems
Yeah.
with that. And again, usually associated with 4 doses and more, not with 2 doses with that, which we will always assess you for that. The vinblastine is given for 1 day, and the dicarbazine, they're more mild, but they always can suppress the immune system. The vinblastine, the V here, can cause more nausea, but it's again short term.
So it's one of those drugs each day a week, like 1 day, 2 day, 3 day? And
Yeah.
then can I give you Keytruda on the same day, or does it have to be on a separate day?
We usually give it before or after.
So I can do all 3 of those, or all that in 3 days? Right?
The carbazine is 1 day. The
Yeah.
cisplatin is that we give it either 3 or 4, and I have to see her
Yeah.
doctor if she give it, if she likes to give it.
She had me 2 options prior when I was gonna do that before we did.
Mm-hmm.
I had it on at 3 days. Okay.
Yeah. If
I'll
she's
just go back to the same kind of schedule I was
Yeah,
gonna have.
yeah, and we'll take it from there. All right. This is not voodoo. I have seen patients like that, and they responded to this treatment, and after that they continue to respond to immunotherapy. That is very possible. It's not guaranteed. I wish I stand up in front of you and tell you I can guarantee
Yeah.
that it's going to work. The chances that shrink the tumors are very high,
Yeah, well, that's good.
and again,
Yeah.
not guaranteed, but very high.
Yeah.
Okay, so let's hope that's our
Okay.
option. What if the CBD does not work? I will have to switch to different chemotherapy, but at that time, maybe we should start looking into this as well, after
Yeah.
2 doses. We will have a plan for them as well.
Okay.
All right? And tomorrow, whenever is the official MRI,
Yeah, they'll call me.
I will call you with that. Okay,
Okay.
but I didn't see anything, to be honest with you. I mean, unless there's something small that.
Yeah, no, that's
that-
fine. I'm cool with that.
What else? That's it for now.
Okay. I got some questions,
Sure.
but I don't know.
He,
So I wrote them
answered,
down.
he answered your clinical
Okay.
trial question.
Never mind.
That's exactly right. So,
Yeah, I wrote that down to make sure I asked about that.
Yeah, yeah.
Okay.
That's exactly
And
what it
then
was.
I don't think my mom's got some questions.
Surprise, right? So okay, we talked about the clinical trials. So we're gonna go over that. you're aware of all the side effects and the issues that he had over the last few weeks.
Well,
that
I
are
was
in the
told
written-
about the chest pain and that. Some of
Okay.
these are explained by.
Yeah, well, when I had that, I showed my oncologist there, and I showed her the scan.
Now tell me more about it exactly. So just.
So I woke up one morning, I slept on my left side, and I woke up and my right shoulder had pain, and it's within the first 2 hours of the morning, it spread all across my chest, and it was like hard to breathe. So we go into the hospital, and I see my oncologist. She, starts, examining me and everything, and we talk about my scan, and I show her all the lesions. She was explaining that, between the lungs and the liver, the lesions, they're pressing on stuff and nerves and all. I forgot all the terminology and everything she did, but that was what was causing all the pain and
Mostly
everything.
started on the right side.
Yeah, it started like over here,
Okay.
and then it would spread across.
It was not a pressure or anything like that.
The what?
It was not a pressure like spread.
Well, I mean, it was hard to breathe. It was chest pains. It was chest pressure.
When you
Shoulder.
When you breathe in.
When I do breathe now, it's fine.
But when you didn't.
Oh, then, yeah, it was
painful.
Oh yeah, very extremely
It will
painful.
induce, the deep breath will
Yeah,
induce.
yeah.
Okay. Yeah. So that's right. So it is.
Yeah.
You expand. You
Yeah.
press more with the tumor already
Yeah.
pressing on that. That's what it causing it. What other issues we have?
Well, some of the side effects he had were the extreme thirst. He had a little lump
There's
on
a lot of
his
stuff
chin,
that
but
went with
that's
the
gone away.
immunotherapy.
Cramping in his calf that they ruled out with the ultrasound. They wanted to make sure it wasn't a blood clot.
Just want to make sure your thirst and the magnesium level. Did
Yeah.
you test the magnesium or?
The blood results were in there.
They're
no,
still
she-
pending, some of them. Some are coming, your lab, your CBC, I looked at it, but some are still pending from
Okay.
today. Let's see what
The cramp just happened that one time. I don't think you
Yeah, it was just the one
mentioned
time.
any other
Okay.
ones. And then just, because he itches and scratches and then he gets sores, so he has a few of those that.
Yeah, but that's normal, I think, with just.
Where is your scratching?
I mean, my legs and my arms, I just get itchy and do this, and then I got one
Now
there.
we have to be careful with the chemotherapy.
Yeah, no, I
Because
know.
at one point it dips, so you don't want to get infected
Yeah,
for that.
no, exactly.
So it's not easy to resist itching.
Yeah, I got some good Lubriderm
Okay,
non-scented
good.
lotion.
Good.
And I'm pretty good about it
And
most of
if
the
it
time.
really bothers you, then you can take the Benadryl for sure.
Yeah.
All right. Okay. This is bump in the road. We still, I cannot, say this is not hopeless, okay? So I know it's not what I wanted to discuss, definitely not what you wanted to hear, but this is reality.
Yeah.
So we're gonna keep fighting. This is the right thing to do, and we'll take it from there.
So I go back up and see my oncologist, and
Now, she will, but before you go there, she will be notified.
by the time I get home, y'all's team would have called her and set it all up.
She's
She's on the phone with her right now. Okay.
No, I will be.
Okay. Okay, yeah.
Will be.
Okay.
How about the ultrasound results from this morning?
That was
Or
yesterday.
yesterday, sorry.
Did it for the legs or?
Or in my scrotum.
Yeah.
I had that done yesterday afternoon. Because those, the lumps I felt in my scrotum, they felt like they got smaller
Yeah.
since last time. Or at least the same size. They definitely didn't get any bigger.
Look at them. Do you mind if I look at them? Or?
Yeah, no.
I mean, they look like smaller actually. Yeah, but.
That's the one.
Yeah, but-
Yeah, no, we're good.
No, we're good.
Just let us know when you're done.
So, and by all means, giving you 2 doses is not enough. That's why I'm gonna advocate through them.
Yeah.
And at one point, no matter what happens. we
And
will
then do
go
I come back here in
and-
6 more weeks?
Yeah.
Okay.
Yeah, and hopefully we'll see some responses, so
Yeah.
that we'll get it into that scenario. All right, other questions?
I think that was it.
All right.
Yeah.
We have to be in a fighting mode, okay? All right, in that situation. So I want to make sure that we are not in the hopeless scenarios. Because
No.
it is not, okay? This is challenging, but it is
Yeah.
not hopeless. We have targets, we're gonna go over them, we're gonna explore all our options with that situation. And hopefully the chemotherapy will give us the answer we want.
Okay.
There will be phase if you're responding to chemotherapy. I will not go beyond 4 doses. This chemotherapy will suppress the immune
Yeah.
system.
So
Depends
you
how
do two
much-
more scans, probably do two more if it's responsive.
Here's a question. We might scratch our heads to go between 4 and 6. Depends on that. But if we go with the Keytruda and the chemotherapy, I want to know if this response immunotherapy related. So at one point we might go with the Keytruda and give the Keytruda a trial if it's working on its own or not.
Mm-hmm.
Because if it's working on its own, we achieved our goal.
Yeah.
If the response was mediated with chemotherapy,
Okay.
we want to do something else. Okay?
Okay.
And that's when we will be screening for all these trials and we're ready for that.
All right.
Okay.
Just to clarify on the chemo, the CVD, that's once a day for 3 weeks, like 3 weeks in a row.
It's not once a day. It's 3 to 4 days every 3 weeks.
Okay.
Okay. The
Okay.
infusion will take 3 to 4
Okay.
days.
And he does that week 1 and then again week 3.
Correct.
Okay, gotcha.
And then you'll come back in week 6 for the scans.
Mm-hmm. Okay.
Other things.
I don't have any other things today.
All right. You go home.
Oh.
If there's any questions, you just let me know.
Okay.
Okay?
Did you tell him about the peripheral?
Yeah.
Yeah.
No, I told
Darren?
yeah.
Okay.
So like every once in a while, and I'm not sure what if it's related to anything or not, but off my left side peripheral, it's kind of like a little light or something.
You
It's
see
kind of like
floaters,
yeah.
but you see full vision?
Yeah, I still got full
There's
vision.
no accidents or anything?
No,
like
no,
that?
it's just kind of like sometimes it's like I got a booger in my eye or something, but I
Right.
don't. But it's like something like I might have moved by my side here or something.
Okay, well, if
I
it
don't
grows, if it's get more frequent, we need to see an ophthalmologist.
Yeah.
Okay, so either you do it there or
It's only it's kind of rare, but I've had a few of those.
Okay.
So yeah.
Well, if you notice that it's being persistent or you start feeling that this is bothering you,
Yeah.
we need to see an ophthalmologist.
Ophthalmologist. Okay.
So the only other thing, as far as communication between you and Dr. Lee,
Mhm.
when Chris has some kind of a side effect or something that happens up there, we're contacting Dr. Lee first because she's right there. She sees him, she assesses, and then she's sending the information down here either through his
But
portal.
Chris can or you can send me that information.
And we do.
That's what- yeah.
We do.
Yeah.
We do. We have been, and it's all in
Yeah,
the portal.
yeah,
And then
yeah.
I gave Dolores a
Yeah.
hard copy of everything today as
Yeah,
well.
okay.
But I call down right after and let you guys know, and then it's in the portal. The missing piece is kind of whether we know whether you've seen it or not.
I
So how
always-
does the team bring
So
it to
here's
you?
what it is, in situation like that, the worst thing to have is 2 chefs in one kitchen. Now, if I think that there was something that I want to interfere immediately with in that
Mhm.
situation, or at least get feedback from your doctor that she's doing the right thing
Mhm.
in a very professional way, don't worry, it's not like
Yeah.
you and that. I will call her
Okay.
and in touch base with her to get the feedback with
Okay.
the situations, The pain that was described at one point, felt like, acute neuropathic pains, and she addressed it appropriately
Yeah.
in the
Okay,
situation.
so no news from you is good news, and if you have any concerns, you'll address it with her.
But
you're
here's
getting
what
the
I'm getting,
information, and
here
it's...
is what I'm saying, if you feel that you want to talk to me, and
Mhm.
Dolores knows that, it's like, I want.
Okay.
Understood.
Okay.
And then I will call back.
Mhm.
Okay, in that
Yeah.
situation, if you feel like you have to need that, I am your doctor, this is your right, we'll check.
Okay.
Okay.
Just wanted to make sure we were
That's
following
not something
that.
should feel heavy. If you feel it, like
Yeah.
you wanna know,
Yeah,
this is why we're here. Okay?
okay. Okay, anything else?
I think that's it. I mean, go back to Dallas and then I guess because if it's a 3 or 4 day deal, instead of going in Wednesday, it could be like a Monday through Wednesday or
Yeah.
you know what I'm saying. So I need to find out
Well,
from them.
we will be in touch with her. and then-
Yeah, because they need to pull insurance. I need to find out immediately. So that's the main thing for me right now is.
Don't think about it.
No, I don't. I just I know that I gotta get in there. Yeah.
The CBD will be approved, and that's why I will try to squeeze the Keytruda. If
Yeah.
they no, we'll drop the Keytruda and we'll start with the CBD before we reappeal the Keytruda. Okay?
With the switch to chemo and introducing that to his routine now, is there a concern about flying, traveling? altitude.
Not concerns about that. No concerns about it. He will be getting shot to boost his immune system
Mhm.
after that in this situation. He will feel queasy a little
Mhm.
bit after that. Yeah.
But okay.
Do you want me how about I schedule a phone call in 3 weeks?
Mhm.
Okay.
Just to chit chat.
That
Sure.
would be a great idea.
Yeah.
Okay.
I'll just
Okay.
put it on. I will
Okay,
just check on how things happen.
that'd be great.
All right.
All right, perfect.
What's this for you? Hang on there. I want you to be focused.
Yeah. Okay.